Okay, so what is the biggest, the question I have is, what's the biggest software which has really created the identity in the world? If you want to really look at the biggest software in the world right now, which actually manages identity in a very authentic format for almost 1.4 billion people, what is that tool and what is the technology? That's Aadhaar. Now, Aadhaar was the biggest inspiration for us for the last 5 years, and I'll say why. In the middle of COVID, what we thought is, okay, COVID has a different kind of a problem really going on. Is something we can help in that particular crisis? What we came up with is something called as, we looked at in COVID, breath is the biggest problem, what everybody is affected by. And that is what is challenged. We created a platform called as Swaasa. We took our infrastructure, we just created a swaasa.org. What this does is, it actually unites the overall healthcare businesses in one equation. This is just to help patients in middle of COVID. That was the thought. There is no monetary benefit, there is nothing here, just we have resources. Can we throw resources to help people? Now what happened is, in that particular process, we started realizing something. The ambulatory services, the hospital services, the pharmacy services, the volunteer services, we curated all this data in the middle of COVID, and we launched an IVR call, or calling infrastructure, for 4 states. And we helped millions of people in that particular process. But what we learned in that was, India is humongous. The IT infrastructure can really go leaps and bounds from where we sit. And our technology can really take a new leap of faith. And we created the COVID awareness and all that stuff, but there is one primary angle which we realized, and that is, if you take the number of people died because of COVID in India is relatively high. And if you look at why, our healthcare professionals, for the size of the country, is too small. We used to spend 2% of the GDP on healthcare. After COVID, we moved it to 4%. If you take North America, they spend 16% of their GDP on healthcare. When our GDP itself is small, and we spend only 4% of it, the employment ratios in healthcare is very weak. That's why whenever we talk to a nurse says after 4 years, they want 2 jobs. 1, they want to go abroad. Number 2, they want a government job. Those are the only 2 things what they want. And we really looked at this, it's because still in healthcare, everything is through word of mouth. They don't hire with technology. We thought, what can we do for this? Being in this particular industry, we started a new infrastructure, a community where we can bring all the healthcare professionals together. And we created Swaasa Jobs. The total healthcare ecosystem in India is only 6 million. We have 3 million people on the product today who actually looks for new jobs and really go with where they want to really go, whether it's internal within the country, go abroad, or have a different career within government. We link all those dots together. And these dots were primarily inspired from Aadhaar as an infrastructure. How can we do it at a price point where it is affordable for India without expecting a lot of profits? And how do we think about scale? See, there is one thing which you have to understand. Let me ask this question. Do religion scale or spirituality scale? Let me ask the question again. Do religion scale or spirituality scale? How many of you think spirituality scales? How many of you think religion scales? Actually, religion is the one which scales. The reason is it's a fixed infrastructure. You follow, you believe, you're okay. Spirituality is an inner journey. You're struggling with yourself. You're finding your own weaknesses, but will be comfortable overall how you can evolve as a person. So what we thought about is, how can we really bring Swaasa to really make the collaboration of healthcare in a different equation? And that's where Swaasa.jobs came into picture. As of today, we have about close to 40,000 jobs on the platform any given day. It's an exclusive infrastructure only for India. Now, here is the point. That's only 6 million. Then we thought about the next infrastructure. It's called as Vihu. This is about 400 million people. Think about people who get a construction work. Think about people who want a job in a restaurant, or people who want to be a driver, or people who want to be like working in a particular household. What is the infrastructure you have today? It's all word of mouth. Vihu's primary infrastructure is about how do we connect the local jobs for consumers. We're about like 400 million people. Bring them together so that we can give a voice for them, so that they can find a job in an effective format. And we really brought in the Vihu.com into the whole infrastructure. We created the whole communication super automated through infrastructure what we built in the platform. But here is the point. The infrastructure what we built is for North America, European customers. We Indianized the whole product because otherwise it won't work. And we made it much more affordable and effective for the audience what we have, because that's the only way we can scale. For us, operations is everything. The reason is that is what makes India scale. So that's in a nutshell what I want to really talk about the Vihu and Swaasa. But is this whole event amazing in terms of what the product you have seen till now? How many of you think that? See, we can really build a lot more infrastructure than this today. But it's just the starting.